and welcome to your head examination. How you doing today? I see. I hope by the time you leave this exam, you feel even just the littlest bit better. Do you mind if I just grab your name and date of birth? Excellent. Very good. And is that your preferred name? How do you like to be addressed? Wonderful. This head examination is going to be rather thorough. We have a multitude of different tests that we are going to be performing. I have quite a few different tools over here that we'll be using. But I will be keeping you in the loop the whole time with what's going on, what I'm using, and why. You have any questions before we begin? Excellent. So for the purposes of this examination, do you mind if I touch you? Wonderful. We're not going to start with that though. I want to test your cranial nerve number 7 to start. This is the facial nerve. So I am going to have you do a few facial expressions for me. We're going to test the ability for your facial muscles to make those. I'm going to have you close your eyes real tight. Good. And can you puff out your cheeks real big? Good. Can you open your eyes real wide? Get some crazy eyes. Yes. And can you raise your eyebrows? Can you happen to raise just the one? What about the other? I personally cannot. I was not gifted with that. And can you smile real wide, showing your teeth? Good. Might look more like a grimace with that many teeth, huh? Yes, and then we are going to try to frown. Good. Good. Okay. So, cranial nerve number 7 looks good. Now we're going to get into some of the touching here. So I am having a little look at you, especially as you are moving around and looking around, getting an idea of symmetry. Is there any drooping in the face? Are there any particular areas that I notice immediately? And I'm actually going to get a little bit closer here. And we're going to see, I'm going to start here at the face. So, while this is a head exam, we are also going to bring it into the neck. And your scalp is part of your head. Sometimes it doesn't feel like it gets enough attention in these examinations. I'm taking a quick peek and look at the neck. A lot of these areas we will look more in depth later. Any pain or tenderness while I'm doing this? I'm going to come up to the hair real quick. I just want to take a little feel. Right. Good. So this texture feels correct for your hair type. I'd like to test the strength a bit, so I'm going to take some strands, wrap them around my finger, and pull. And they should hold, unless the hair is very weak. Okay, so I'm going to take a strand, wrap it around, and pull on it a bit. And you shouldn't feel any of it as I'm tugging, making sure it's not actually pulling at the scalp. That would be rather unpleasant. Okay, good. There we go. Let's try on this side. Good. Now I'm going to run my fingers through your hair. And I'm just going to see, are there any hairs that get shed with this? If we have more than 10 hairs, then we might be dealing with some hair loss. So far, nothing's really coming out, just a couple, which is normal. Now, I want to take a peek at the hairline and the scalp, if you don't mind. I'm just going to be using the little pick at the end of my comb to move the little hairs along the hairline around behind the ear here. Good. There we go. I'm just going to take a peek around at the scalp. Have you had any issues with the scalp at all? No. Okay. No itching, no pain, tenderness. No. Okay. Good to know. Taking little sections, taking a look, looking at the skin as well as for any abnormalities. Want to make sure you don't have a suspicious mole or any lice. Good. Good. So I'm just going to smooth the hair back down. There. Very good. Let me put that back down. And now I'm just going to take a look here. I'm going to get real close. And we're going to take a peek at the face here. Just looking primarily at the skin. Good. Good. And we're going to get a good feel of the different muscles and the lymph nodes and whatnot. But first, I want to hit a couple places before we do that. So I'm going to be pressing in on the sinus cavities. We have the frontal, the ethmoid, and the maxillary in here. Let me know if any of this is tender. Let's start right here. Good. How is this? Press. Okay, we're not feeling any pain or tenderness. Good. It's about getting that time that we would start to see sinus issues. Now I'm going to do some direct percussion and tap along these areas. This might accentuate any tenderness. No, let me know if you feel any anything here? Good. Very good. So now I'm going to do the second thing. That's going to involve me bringing in my stethoscope. And I'm going to be palpating the temporal pulse right here. I'm just going to do this bilaterally. Hold it there. Good. And then I want to take a little listen to it. We are going to auscultate with the diaphragm of my stethoscope here. So I'm just going to place this right here. Listen. Good. And on the other side. Good. So we will use this later, but not for a bit. And then we are going to get into the muscles, the glands, and the nodes. I'm going to have you turn around so that I can get to these places. Alright, so from behind here, I'm going to start right down below. We're going to go up and down here. So first, I just want to feel the thyroid here. Could I have you take a dry swallow? Just like that. Good, good, okay. You won't need to do that for a little bit. And we'll come up here. So I'm going to feel the master muscle and the temporomandibular joint here. I'm going to have you do a few things for me so I can test these. I'm going to have you clench the jaw, unclench, clench, unclench. Good. And now can I have you open and close the jaw? Open, close, open, close. Good. Now I'm going to have you move your lower jaw to different directions. So I'll have you move it up, down, and to each side. And I have you move it to your left and to your right and down and up. Excellent. I'm going to come to the temporalis muscle right on the sphenoid bone. Good. Okay, and can you clench the jaw? Unclench, clench, and unclench. Good. So these two work together. They're your more superficial muscles of mastication. We want to make sure those are doing all right. Now let's get into our glands and nodes. So we'll start with the occipital nodes here, and then go to postauricular behind the ears, preauricular in front. We'll come down to jugulo-digastric rather, and check on the parotid gland. Okay, submental and submandibular here. Good, and the cervical nodes. We have anterior cervical, posterior cervical, deep cervical chain. And then lastly, supraclavicular. Good. Okay. Nodes, glands, and muscles are doing just fine. If I could have you come back around. Just jot a few notes down. Now we're going to be doing a bit of an intraoral exam. In that, I'm going to grab my tongue depressor here and my light. And we're going to take a peek inside. If I could have you open your mouth for me. Good. And we're going to take a look at all our tissues. So, I'm going to have you lift your tongue to the roof of your mouth real quick. Good. We'll just look at the floor of the mouth. Okay, and you can let your tongue relax. I'm going to look in the pockets of the cheeks, the oral mucosa, salivary glands, if I can get those. And I'm just going to pull your lip down here. I can check right here, and I'm just going to, leverage that a bit. Okay, and the upper lip. Good. Okay, and let's take a peek at the tongue. If you could stick out your tongue for me. Good. And I'm going to test cranial nerve number 12. I'm going to have you lift your tongue up, down, and to the side, and the other side. Wonderful. If I could have you stick your tongue out all the way again. We're going to check on the throat. I'm just going to put the tongue back of the tongue, the throat wall. Good. Can you say ah for me? Okay. And would you mind taking another dry swallow? Good. So cranial nerves 9 and 10 look good. Glossopharyngeal and vagus. Lastly, I want to check on your teeth. So you could just open your mouth, let your tongue relax. We're going to do a little counting here. We have 1, 2, 3, 4, incisors. 1, 2, 3, 4. Canines. 1, 2, 3, 4. The 8 premolars and 8 molars, 8 incisors, 4 canines rather, 8 premolars, and 8 molars. Everybody's there, and they look great. You can close your mouth. We won't be doing anything like that for a bit. And let me just jot down the intraoral exam. Came out well. Now we are going to pivot to cranial nerve number 5, the trigeminal nerve. We're going to be testing this, the sensory aspect of it, with a cotton bud and a toothpick. We're going to be doing what's known as the soft, sharp test. And this way we can test your face's ability to sense stimuli. So I'm going to have you close your eyes, and if you could just tell me if you feel the soft or the sharp touch. Soft, good. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. 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 Soft. 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 Sharp. 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 Wonderful. Cranial nerve 5 looks good. Then we're going to be moving on to the eyes. And I'm going to get up closer and we're going to take a little look here. Around the eyes, do a little palpation. Look at the lacrimal glands here. And the eyelids at the sclera, the iris, and the pupil. Good. Excellent. And I'm going to pull up on the eyelids. I want you to look down. Take a look at the conjunctival tissue. Look down. Look down. There, and I'm going to pull down and you look up. Look up. Look up. Good. Good. Now let me grab a little tool real quick. And we're going to look at the back of the eye. This is called the fundus. For that reason, this is called a fundoscopy. Oh, I am going to have you just hold your head still. I'm going to put my hand on top of your head, and I'm just going to come in real close. And, okay, get the red light reflex there. And take a look at the back of the eye. So back here we have the optic disc / optic nerve. We have the little blood vessels, the macula, fovea. Good. Just keep looking straight ahead. There we go. Okay. And we'll switch. Red light reflex. There we go. Right off the bat. And coming up real close to take a look. You're doing very well here. Really appreciate the patience and cooperation. Okay, very good. Just put this off. We won't need this anymore. Good. Now we need to test eye movement. We need to test your eye's ability to focus in on objects at different distances, known as accommodation. I'm going to check your direct consensual response, your pupillary response. So for now, I'm just going to have you look up. Look up. Look up. Good. And look down. Look down. Look down. And look to the side over here. Good. Just look to the side. Look over here. To this side. Good. And right up here. Diagonally up. Diagonally down. Right down here. And diagonally up. Diagonally down. Okay, focus on my fingers using only your eyes here. Just going to run through that. Good. I'm going to test your eye tracking here. Make sure there's not any skipping or delay at all. Good. Just keep following my fingers. There we go. Now, keep your eyes on these fingers. We're going to go out and in, out, in, out, and in. Good. Other side here. We're going to go in, out, in, out, in, out. Very good. So, bringing in the light. Just look at my nose right here. I have to look at my nose. We're just going to take a little peek here. Good. Right about there. That's a good spot. Okay. Just keep looking right at my nose here. Checking pupillary response. Just keep looking right here. Good. We want to make sure the pupils are equal, round, and reactive to the light. There we go. Right here. Good. There we go. Now I'm going to put my hand between your eyes. And I just want you to keep looking forward. Look at the direct, response and consensual response. Good. Other side. Direct response and consensual. There we go. Cranial nerves 3, 4, and 6 look good. We have oculomotor and trochlear and abducens. Have you recently had an eye exam? Okay, so cranial nerve number 2, optic, is probably all good, or they would have noticed. And lastly, even though you have had a recent eye exam, I want to check your color vision. I have some colored gels here, and I'm just going to tell you a couple of colors here. So this one we are considering hot pink, and this one is just pink. Other than that, you'll have to figure out everybody else. So I'm going to put a gel in front of your eyes, just like you to tell me what color you see. What color is this? Pink. What color is this? Purple. Good. What color is this? Blue. Good. What color now? Hot pink. And what about this one? Orange. Very good. This one. Go with green or teal. And this color. What color do we have here? Yellow. Excellent. Let me shuffle these. Pink. Good. Yellow. Hot pink. Good. Orange. Orange. Green or teal, yeah. Blue. Right, let's do one last shuffle. Yellow. Orange. Hot pink, good. Blue. Green or teal. And purple. And pink. Last one was pink. Good. Oh, it just so happens I was missing a color. What is this color? Red. Very good. Your ears. Let's take a little peek at your ears and pop the Onoscope together. Match up little line here with our indentation, snaps right on, and then let's come to the ears. So we are just going to do a little inspection here, and we had a general look earlier. Got to look behind the ears. And feel any pain or tenderness here? Okay, good to know. And then we're going to look inside the ears. We've got our light. There we go. Very nice. And I'm going to pull the ear up and back, and that straightens out the ear canal. Up and back. And take a little look in the ear. We are looking for signs of infection, impaction, irritation, injury. Have you had any issues with your ears? No? Okay. And any issues with your We do have some still to cover yet. We'll look at my finger is just pressed against your cheeks so that I don't hit anything. Even if you move, I'm not going to accidentally stab you. Your canal looks good, clear, no redness, and the tippity membrane, light, tip of the malleus through the hammer, no perforation, no impaction, no bulging. Looks good. Everything looks very good and clean. I think you're really taking care of themselves very nice. Good. The ears are looking pretty good. Now for our vestibulocochlear nerve, we are going to be doing a bit of a whisper test. I just want you to tell me what you hear me whisper, alright? Wonderful. Exit. Porcelain. Iron. Bucket. Stone. Plastic. Cable. Blue. Lever. Support. Vent. Fan. Chip. Hole. Mirror. Chalkboard. Window. Concrete. Oval. Brown. Okay. Did all of those come in fairly clear to you? They easy to understand? Very good. And you said you've had no issues with your hearing, right? Okay. Let's move on to the nose. Take out that speculum. We'll get a new one. There we go. And have you tip your head back. We're going to look inside of the nose here. So, let's breathe normally here. I'm going to look at the septum and get a little bit of the turbinates here, the inferior turbinates. There we go. Deviation, perforation, nasal passages. Very good. Internally, it looks all good. And I'm just going to be pressing on the nares here. Any pain or tenderness? No. Now we're going to do a little breathing test. I'm going to occlude one side, and I'm just going to have you take a few breaths out of the one side, then we'll switch to the other. I won't have you talk and make your voice all nasally though. So, we're going to occlude one side here. And if I could have you take a deep breath in through your nose, out through your nose, and again in, out. Right, other side, occluding the nostril, deep breath in, and out. Deep breath in, and out. Good. Do you notice any issues with your sense of smell? Okay, I'm going to test a couple smells on you. Let me know what you think it is. So we have right here. What's that smell? Cinnamon. Good. And this one. A little strong, yeah. What's that? Good. And I'm just going to hold one side closed. Tell me what this smells like. Peppermint, wonderful. The other side. What does this smell like? Lemon, good. Last one. What does this smell like? Lime. Very good. Somewhat similar, but not exactly. Nose is all good. Cranial nerve number 1, olfactory, is intact. All the smells were correct. Now we're going to take a peek at your neck. I'm going to start by auscultating the carotid artery. So if there's an issue with that, I don't want to be pressing in on or around the carotid. Now I'm going to have you take a deep breath in and hold. That way I won't hear the flow of air through the trachea while I'm trying to listen. I can just isolate the blood flow. So, take a deep breath in and hold. Listening for any bruits. And you can exhale. Deep breath in. Hold. Bruit, B-R-U-I-T, is an audible heart murmur. And exhale. done with that one. I'm going to palpate the carotid. I'm not going to do both because that's going to be really uncomfortable. We're going to do one at a time. Just going to come right in here and feel the strength and the cadence. Good. Other side. Good. Okay. So we are going to take a look at the neck. We've already assessed the thyroid, but we do need to make sure the trachea is midline. Look at our hyoid bone, our suprahyoid and infrahyoid muscles here. So trachea, make sure that one's in the middle, that there's no deviation. Good. And the hyoid bone right in here might be a little uncomfortable. I apologize. Okay. And suprahyoid muscles. Infrahyoid. We have the cricoid cartilage. Okay, any pain with any of this? Okay, good to know. Now I'm going to have you extend the neck, and I'm going to get another feel from not exactly a different plane, but this helps to exaggerate any lumps, bumps, abnormalities. Okay, just keep the neck extended. Good. Taking a peek. We have the big muscle here is sternocleidomastoid. Taking a look at that. Could get in the back and maybe like feel around trapezius and levator scapulae. Good. Another big muscle here that we're not really concerned with, but is one of my favorites, is the platysma. So when you make sort of a, gosh, I don't know if I could do it on command, but a grimacing sort of movement, then there's this big sheet right here that helps with that. Can't do that one on command, but we're not so focused on the platysma. Good, okay. Let me just jot that down, and I think we've got another cranial. Yes, we have a cranial nerve. And also, I want to take a look at the jugular venous pressure in the neck. I'm going to have you turn your head to the side, and I'm going to look. There's going to be a little pulsation that I want to take an eye on, take a peek at, rather. And just turn your head here. I'm going to just take a look at the pressure there. Good, and go ahead and just turn your head to the other side. We'll just have a bilateral look. Good. Good. Now, cranial nerve 11, the accessory nerve, I am going to have you bring your shoulders up and then down. Just give me a few shrugs here. Okay, any pain, weakness, or restriction? All right, I'm going to push down on the shoulders. I want you to push up against me. Good. And now I'm going to have you bring your shoulders up. I'm going to try to push down, and I want you to resist me. Very good. Lastly, head range of movement. If I could have you turn your head to one side, the other, go up as far as you can, nose towards the ceiling, and down, trying to tuck your chin into your chest. Tilt to one side, little lateral side bend. And the other side, trying to touch the ear to the shoulder. Good. Any pain, restriction, weakness? No. Okay. Wow. That was indeed rather extensive. And we only have one last test. I'm going to grab my tailor or tomahawk hammer here. I'm going to have you very slightly open your mouth. I'm going to put my thumb right here in this divot, and I'm going to tap on my thumb. This is called the jaw jerk reflex. It's a bit of a funny one, so open your mouth just slightly. Good. I'm going to put my finger right here, and then we're just going to give it a few taps, and you can put your jaw back. So the jaw jerk reflex, a normal response, is no response at all. Probably makes it a little surprising when someone does have a response then. No response. I'm just going to go over everything and make sure that we got everything in this rather thorough examination. Cranial nerves 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 with accessory, and 12 with hypoglossal. And did our palpation, temporal arteries, nodes, glands, muscles, TJ, the eyes. Forgot to record the pupillary response. Here, ears, and nose. Yes, I believe we have everything here. Do you have any questions at all? No? Alright, I'm going to sign off. And that will conclude our examination. I'd like to thank you so very much for coming into my office for this extensive head examination. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation, our throne wish list